Alrighty, guys, thank you for coming and tuning in to another episode of Paid in Passion, where we let our passions work for us.
Yeah.
Today we have one of my homegirls from a while now,
Twins.
Ciara. Where have you been? Could you introduce yourself to us, please?
Yes, my name is Ciara. I'm a medical device representative, and I have been friends with Josh since chemistry. What?
2017, 18?
Yeah, I don't
Yeah.
know what it is. PTSD, but
Yeah,
okay.
I pushed all those memories out my head.
Yeah.
Okay, could you describe for us what medical devices are?
Yes. So medical devices typically are things that are implanted into patients. And for that, we have representatives that sell them. So it's a long list of avenues that we have and divisions that we have. I'm in cardiology, so I sell stents, balloons, imaging equipment, the list goes on. But there are so many different avenues out there.
Okay. Could you give us like a day in the life of a medical device representative?
Yeah, so honestly, every day is different. So it's consistently inconsistent. But on average, I wake up at 5:30. I head to one of my accounts at probably 6:30 or 7. Sometimes maybe even later, like 8. It really just depends. But I get there, I'm supporting cases. So I'm in the surgeries as the physicians are using my devices, and I'm there the whole time. If they have any questions, I'm there to, give answers. I also do education. So I may or may not do that in between cases, or I might allot a time to do like presentations. So that's really what my day consists of, is just supporting cases, doing education. I feed them too.
Hmm.
Um, so yeah.
So when you say them, as far
Them,
as
yeah, as in the staff. So like the nurses, the techs, the doctors, um, sometimes like supply chain or like other departments that I interact with.
okay, that sounds good.
Yeah.
How did you find this industry?
So I found it after taking chemistry and physics and taking the MCAT, and I was like, yeah, this isn't necessarily going anywhere. And plus, thinking about the financial aspect of going to medical school, I was like, I need to find something else to do. So, a nurse practitioner I was shadowing, she told me about it, and she was like, "Oh, Sierra, I think you'll be good at it." So I looked into it, I researched it, and then I thought it would be easy, but it really wasn't. It took me about 2 years to land my job, and it was really just a lot of like applying to jobs, networking with people on LinkedIn. It was crazy times. A lot of
Okay,
rejections, but
yeah.
here we are.
What was that process like? Find because I think, especially like working in like healthcare, I feel like for those who aren't pre-health per se,
Yeah,
if you're like, it's easy. I'm not gonna say it's easy to go to these schools, but like as far as direction, if you want to be a dentist, you go to dental school.
yeah.
That's like more straight paths. But how is that process of you had 2 years, like the process to getting the job that you have now was like 2 years. So like, what was
Yeah.
that process like?
So again, it was a lot of like applying to jobs. I thought if you see something online, you apply for it and you get an interview, and that's really not the case. I think what was most successful for me was directly reaching out to people on LinkedIn. So if I saw a recruiter listed on the application, I would just reach out to them directly, or like a hiring manager, something of the sort. And there still wasn't success with that, but that was the most successful thing, I feel like. So it was really just like chopping away at the wood. And luckily, through that, I was like connected with someone who got me a job interview, and then they ended up recommending Medical Sales College, which for me was a 12-week program that really kind of introduces you to the industry,
Mm,
tells you what it's about, what the day to day could be like, and like the clinical aspect of the role too, because it's not just sales; it's also clinically driven. So I went to that program, and I think that was definitely like groundbreaking for my career and
mm,
getting a job.
okay.
Yeah.
So how did you stay determined to stay in it? Because I know usually like with people goals, if it's taking a while, it's like, okay, let me just deviate into something else.
Yeah.
And again, like 2 years is a long time. So how did you stay like goal focused and say, this is something I want to do, and I'm going to pursue this.
Yeah.
No matter what.
I mean, well, I had a job at that time, so it was easier, but I still had the pressure of not wanting to stay in that job and stay in that role. I was a patient care coordinator at a fertility clinic at the time, and I was working from home. It was during COVID. And, well, actually, let's rewind. So I got the job and I put in like a vacation for, I think we went to Jamaica and Miami, whatever. Anyways.
During COVID?
Yeah. Well, no, right before. Right before. So I went on a vacation the week before COVID happened. So once we got back, they said, "Oh yeah, Ciara, unfortunately they had to drop me." So, but they ended up picking me back up months after.
Okay.
When things got better. But anyways, during that time, I was just like, okay, yeah, I need to find something that's, more consistent financially, and something I'm actually passionate about. So it picked me back up. And then during that time, I was like, I'll work this job, but I also need to focus on my career. Because that was just a job and I wanted a career.
Right. So as far as like in the healthcare field, what were your passions, or what are your passions like in the healthcare field?
Well, my biggest thing is just helping people and like helping patients. I did a lot of shadowing in undergrad. So I thought I was going to be an anesthesiologist. So I did a lot of shadowing with that. And I just loved how it was kind of like exhilarating being in those operating rooms and like seeing the doctors fix those patients up. So that was the main thing that brought me to medical device sales, because I was like, if I can't be a doctor, then I want to be something adjacent to it.
Yeah.
And I even looked into nursing, but again, I'm not a good test taker, as you know.
I don't know that. Shout out to genetics.
You don't know, yeah. But yeah, so I was just like, I need to find something adjacent to that where I'm helping people, helping patients.
Yeah.
I can also like be myself with it, and then I'm not like complacent and feeling like comfortable every single day. Because honestly, with this job, I feel like I'm on my toes every day.
Yeah. Okay.
Which is a little nerve-wracking, but I love it.
Yeah, it keeps you. I think when jobs are like keep you on your toes, that's like you're destined to like do your best, versus jobs where it's like I can get away with doing anything, and at the end of the day, especially like at our age now, that's kind of like cheating ourselves.
Yeah.
Like, we do have to, because again, like in college, we have those tests, we have those projects, those grades that are like pushing us to be like, all right, I don't want to grade below this, so I actually got to push myself.
Yeah.
Versus in the workforce, you can have a job that's like, oh yeah, I can just chill, but there's no growth in that.
Right. Yeah. And that's what that job for me was. I was working from home. I can work from anywhere, basically.
Yeah.
Jamaica. So I had I wasn't working from there. I took PTO for that.
Okay.
But anyways, so I just felt like super comfortable working from my bed, waking up, logging on, maybe not taking a nap, and then waking back up and doing work.
Okay.
Which, I mean, I guess is a good thing. Like, you can be efficient doing like 8 hours of work in 1 hour, and that's what I was doing. But still, like, what else was I doing in those other hours? So I just felt like I wasn't being productive. I was in the same place every single day. I wasn't interacting with people. So yeah,
I might need to apply to that job. Oh, okay.
It works for some people though, but I just like things to be different. I like a little
challenge.
Yeah,
you need that though. You need that for growth for sure.
Yeah.
So you mentioned that a nurse practitioner that you're shadowing kind of introduced you or recommended the field to you.
Yeah.
What did that practitioner see in you that was like, okay, I feel like you will be good for this job?
Yeah. So for context, she is a family friend that I was shadowing, so she kind of knew me more personally. But I mean, the main things and what she thought would help me being a medical device rep was, one, if I have something that I want, like in my mind, or like a vision that I have, I'm always going to execute it. So like just being competitive and being goal driven was something that I guess she saw in me. And then secondly, like, she knows that I'm, a bubbly person. I like to think of myself as a nice person. Yeah. Which, that doesn't hurt. And then I guess the intelligence, and
Mm-hmm.
obviously in chemistry it didn't shine.
Chemistry is
But
different, though.
yeah.
I'm not gonna lie. And I think coming into this interview, I knew I was gonna like this one because it's like we had a lot of classes together.
A lot.
We had a lot of classes
A
together,
lot.
and it's like I don't even know how to describe it for real because it's like
Yeah.
we really used. I don't want to use the word struggle.
We were
But
in the trenches.
yeah, we were.
I was in the trenches. You weren't,
No,
but
I
I
was.
was.
I was just very secretive about being in the trenches.
Oh God, yeah.
I'm not what I was trying to do anyway. But yeah, no, coming into this interview, I was like, I would definitely like. I've been wanting to do this interview because I was like, yeah, me and Ciara, you're one of the few people that like we actually had like a lot of classes like every year.
Yeah.
And it was just like, so to see what like usually like people who are, taking those classes like biochem, genetics, things like that, they're going on that hard medical clinical side.
Yeah.
But you were able to still work in the industry, but find a different avenue, which I think is very important.
Yeah.
Because as you said, you wanted to be in the healthcare field because you wanted to help people and things of that nature.
Yeah.
But I think it's also important to know your strengths and weaknesses, like, and to be real with yourself. Which you have to come to that time is like, all right, these are the classes that we're always going through, and no cap. Like no cap, but like I don't want to keep saying that we were struggling, but it was just
I was struggling.
We was like, this can't be what our calling is. Even though we do like the industry, do like healthcare field, which I think a lot of people do like, but there's a realization, especially when you go through those classes and things like that. If it don't, for me, it's like if it don't click at the point, this ain't something I'm supposed to do.
Correct. Yeah.
And that's how it was with healthcare. Because I do like healthcare, I do like helping people, but maybe the clinical route wasn't for me. Yeah. And I do know that's a lot for other people, but they're trying to find other industries where they can work in healthcare, but they're not going through 12 years of school because honestly, that's just not for them.
Right.
Some people that is for them, and I salute them. They're very strong for that. But like for me, I was like, after chemistry 1, I didn't want to do no more. I don't do no more. But
what was the chemistry before chemistry 101? I took that one, and I was still
I didn't have to take that, and I think that was the problem that I had with college in itself. I was, again, coming out of high school, like I was a smart kid. I was able to test out of classes during orientation, all that, cool. But when it actually came to college, and it was like, oh, whoa, I don't know any of this stuff. They're teaching it. I'm not grasping it. And I know I'm smart. So that wasn't, it was just kind of like that, what is it called? Something syndrome.
Of my head.
Imposter syndrome.
Oh, okay.
Where it's like you know who you are, but I guess like the environment and the situation that you're in right now, it's kind of like maybe I'm not. Right. And that's kind of what it was like, especially with those are the only classes that I struggled with were like those chemistry classes, like even biology and stuff like that. I was okay in, but then chemistries,
physics, OChem.
Yeah. I was showing physics, but that was for other reasons. That was for other reasons.
Yeah, it's but I do feel like an issue that I had like after graduating college was that I just thought it was either going to medical school, nursing, what are the other
like dental,
PA.
dental,
so they only, in my eyes at least, or my perspective, was like it was only so many options that I had, and it was kind of hard and difficult trying to figure out like, okay, if I'm not a good test taker, then what can I do?
Yeah. And being real with yourself though, it's like it's okay to like, because everyone's not a test taker. Yeah. And it's okay to be like, acknowledge that and be like, okay, if I'm not the best test taker, why would I just keep taking tests?
Exactly. And another thing for me was, okay, what if I get into medical school? There's still more tests to take and a whole big test. And if you fail that big test, then it's just like, in my eyes, your career is over. Yeah. So I was like, I don't even want to take that risk. And so it just took 2 years of kind of figuring out what I wanted to do. Was I sure about it? And the funny thing is, I feel like with medical device sales, it's something that people don't really know about.
Right.
Until you know somebody that does it, and it's
Right.
like, oh, okay, then what do you do? And then you have this like conception of, or did I say conception?
Yeah.
Perception.
Okay.
Perception of it just being like 100% sales, and that's kind of, I mean, that's obviously integrated into it, but it's not the majority of what it is.
Mm-hmm.
It's really clinically like being kind of on point with that, and then I feel like the sales would follow.
Okay. So
Yeah.
could you give me like an example of a specific
This
like
sounds like an interview, Josh.
it's not
This
an interview.
Yeah.
I mean, it is an interview. What you mean?
Which let me tap on that though. Like applying for jobs and interviewing, I hated it. I hated it so
Yeah.
much, and I went through so many interviews. Like if you call Ty or any one of my other friends, they'll be like, "Oh yeah, Ciara, she's been through so many interviews."
Yeah.
But I think it's maybe better,
Yeah.
you know. But anyway,
Yeah.
go back to your main point.
I was gonna ask for like an example because right now I'm really trying to grasp like medical sales. You say you work in cardiology.
Yeah.
So, or that's your main focus. So, could you give us like an example of, a target audience that you use a medical device for, or like what was the medical device that you represented?
Yeah.
Yeah.
So the company that I work for, there are like lots of different divisions. So there's a cardiology group, there's endoscopy, so they work with your like GI tract.
Mm-hmm.
There's like pelvic health, neuromodulation, the list goes on. But within the cardiology group, there are different groups within that. So we have coronary therapies, which is what I'm a part of, but there's like CRM, which is cardiac rhythm management, and that's for like pacemakers, defibrillators,
Mm-hmm.
and then the list goes on after that. But for me, for coronary therapies, I sell products or therapies for the coronaries. So you have coronaries in your heart, and for a lot of patients, they can get clogged up. And when they do, we have products that either help to, like in simple terms, unclog them up, or they just kind of expand them back to normal conditions.
Mm-hmm. Okay.
So I sell stents, balloons, guide wires, and catheters to give the physicians access. And then we have like some imaging catheters, so the physicians can actually see what's going on in your coronaries.
Okay. So what would you say like the success rate of when you go to, I'm assuming that you go to like hospitals and things like that.
Yeah, I do.
So what's like the success rate like when you go to one of these hospitals and you share your product with them? What's like the rate that they say, okay, yeah, I want to buy your product,
right,
versus they don't?
Yeah. So it really depends. So there are like different stages out there. So one, the initial would be like a product launch. So that would consist of me educating the staff and the physicians on the product that I have. So for instance, if it's a stent, luckily for my company, we have like FDA approval for most, if not all, of our products. And then we also have clinical trials to show like best in class, whatever. It could be like strain deliverability or whatever compared to other competitor products.
Right.
So that gives us kind of like an advantage. So physicians, there's like a greater chance of them wanting to acquire our product and have it on the shelf.
Right.
And then like the second stage of that is, they'll talk to their like pricing people in their departments in the hospital. And then when everybody is kind of open to having that product, then the next hurdle is them actually using it.
Right.
And so that's where me physically being there and supporting cases comes into play, because if they see my face and we're having conversations and I'm helping them during the case, they'll be more inclined to pull that product.
Okay. Yeah. That makes sense. Okay.
Yeah.
Where do you see your future with this, or like what's your future goals being from this? Yeah,
so a goal of mine, ideally I would love to stay with the same company. I don't know why, but like I just want to say that I've been with this company for like 25 plus years, because there are a lot of people at my company that say that, and it's like inspiring to see like that's where they started. They had like myself, like they had a lot of questions, were new, were uncomfortable with the learning process, and then here they are now, like as a regional manager, area vice president, or vice president, or even president. So that's something that I kind of want to acquire.
That
That's
sounds
my
good.
life goal.
Okay.
Yeah. Whether that I want to definitely be some sort of manager
Okay.
of some capacity.
Okay. What would be your like advice to someone who who may want to enter this field or something, maybe someone who is interested in healthcare, but they're not wanting to go into the clinical aspect of it?
So for that, I would say, like I said, there are a lot of different divisions out there, and cardiology, you definitely have to have that clinical acumen
Right.
for it. But there are other companies or other divisions that aren't so clinically driven. So I mean, I would just direct them that way if they
Mhm.
don't want to kind of have that clinical part of the job. And then there's also pharmaceutical sales too, which is still clinical, but you're, at least to my understanding, like you're not in cases as much. Like
Mhm.
it's more so you're going to doctor offices
Mhm.
and kind of selling in that way.
Okay.
Um,
What are cases?
cases, sorry,
Mhm.
surgeries,
Okay. Okay.
surgeries, yeah,
Okay.
yeah.
Okay.
So
So you get to well, no, you don't get to see the surgeries.
yeah,
Oh, wow.
yeah. So I'm actually in the surgery, the operating room. We call it the cath lab. So since
Oh.
I sell like cardiology products, it's called the cath lab where the cath patients go. And so I'm actually in those rooms. So I like put a lead vest on.
Oh.
Yeah, that's pretty cool.
Wow.
I love it.
Yeah.
That's like probably like the number one reason why I love the job. It's
Oh.
because I'm actually there seeing everything. I'm seeing them cut the bodies open, put it in there.
Oh, wow.
Yeah,
So you get to see them use your product.
yeah,
And I guess that's where you're able. Okay.
yeah. And I kind of get that like instant gratification too of like, okay, they're using it.
Mm.
And one of the cool things about one of our products is that it's like imaging, so they can see what the patient's coronary arteries look like
Mhm.
before, and like it might be like clogged up. And then when they use our product, you can kind of see the post
Mm.
like picture or image, and you
Okay.
see, you know,
That's cool. I didn't know that you could still be in the operating room.
yeah, yeah.
You may know this answer or not, but like, why? Why? Why
Why?
are you allowed in the operating room?
Because they may have questions. Um, so like I said, it might not even be about the products per se, but they may like want your advice on like what to do.
Hmm.
And we've had training like through our company and everything to be
Okay.
able to provide that advice.
Okay.
So it's not like a random stranger or
Right.
person
That's
coming in there.
cool.
But
Okay.
yeah, that's another thing
Ooh.
of why like it keeps me on my toes, because I don't want to tell the doctor something that could potentially,
Right. Right. Right.
you know,
Okay. I didn't know
influence the
that.
patient. Yeah.
I didn't know that.
Yeah.
Okay. That's cool. Okay. So
Are you trying to grasp
no,
that?
I am trying to grasp it because my vision of it, because I know people who do pharmaceutical sales. Well, I knew about pharmaceutical sales because that was something that I was going to do after college. If I didn't
Yeah.
get my master's, I was like, okay, I got a biology degree. What can I do with this? I'm about to do like pharmaceutical sales or something. So,
Yeah.
and I'm doing research and stuff, but you know how like research kind of goes. It's like you only know so much.
Mm-hmm.
Like even then, like I saw medical devices, but like my vision of medical devices was
Completely
like
different
I
from
was
what
like
it is.
I'm gonna be selling like stethoscopes. Like I was like, nah,
Yeah.
I don't get on that. But going to the okay, wow,
Yeah. And
hmm,
I heard, I've never seen the movie. Well, I saw it when I was younger, so I can't really remember, but Pursuit of Happiness, that
hmm,
was kind of the only idea I had of medical device sales, was that it's like a
oh,
struggle, like you're gonna be out there, like you're not gonna make any money, and if you do, then like everything's great, but like they're still like struggling that.
you did medical devices.
That's what I heard. And I think so. He's because it was like a box. I vaguely remember it,
I'm gonna have to fact check that.
but that movie was just so depressing that it
Yeah.
kind of, yeah. But that was my idea of what
Okay.
it was like. Like you're gonna be like struggling to
Hmm.
sell something, which could be the case, but like I really love the job.
Hmm. Is it like a commission based?
Yeah. So typically it's like base salary plus commission.
Right.
Obviously the commission is like based on your performance.
Right.
And each company has their own structure of what that commission will look like, and total compensation will
Hmm.
look like. Um, but yeah, I think it pays well.
Okay.
Yeah, and it really depends, but I think it pays
I
well.
mean, you got to put you. It's more so like a lot of jobs, like whatever you put in, you get out. And,
Right? Yeah.
You can't just like chill
Yeah.
and think you finna get paid. Type
Right.
thing.
And I think another thing that helps is with my company, like we have great products, so it's easier to sell as opposed to a company that may be like a startup company.
Right.
So you're really trying to like make your mark on that territory, and it's going to be a little bit harder. So the commission obviously will be a little different, and your compensation might not be as high as elsewhere, or it could be really, really, really good if it's a good product and it's like new.
Yeah,
because people want it.
Yeah. What were your like? Was it like something specifically that you have to have in order to get this job? Like, obviously, you don't have to have like a bachelor's degree or something.
Yeah.
But was it like any like certification, or did you have to do something else that they want experience in, or was this one of those jobs that you really just got to keep applying to, and based off their interview, if they feel like you're a great fit, then you're good.
So I would say this job is more so on the it's not what you know but who you know.
Okay.
So like networking is like the biggest thing. So that person that I connected with actually recommended for me to apply for a scholarship through my company. Okay. This is before I was even hired. So they basically said, we'll give you a scholarship to go to medical sales college, and then we'll also take you onto our team after graduation. So I definitely think like medical sales college will definitely help, but at the same time, it's more so like just networking. Okay, that's the biggest thing, and that's really the biggest thing that I got from medical sales college was the importance of networking, and they connect you with different people.
Okay, so medical sales college was like something that you did.
Yeah, so it was something I could put on my resume and talk to people about when interviewing. But the biggest thing again was just like networking, which if you put in the time and dedication, I feel like you can get there.
Okay.
Yeah.
That sounds good. Oh wow.
Yeah.
I learned a lot myself because I like doing things like this. Like, I mean, because I use it for my own self. Because we took the same classes and stuff like that, and we kind of like we were both in that clinical aspect to not clinical aspect.
Yeah.
So like even now, like I am looking at different things, and pharmaceutical sales was something that I thought about. So since hearing this now, I was like, okay, this is interesting. And even to tell other people that,
it is.
they can watch this video, but also just talking in general to people, it's like, oh yeah, this is another career aspect that, you can go into. So, okay, that's cool.
And I feel like it would be like super helpful if we went to like high schools or colleges and could talk to people about it because it's really not that known. But I think it's a great field.
Yeah.
I'm new to it, so I think I'm still kind of like in the honeymoon phase of it. But I think that it's definitely, I see some longevity in it.
Okay, that's good.
Yeah.
That's awesome.
Yeah.
What are you about to say?
Oh, but yeah, I was gonna say it like the idea of what you think medical device sales is, it's kind of like the opposite of it. You're really just like educating nurses and staff on your products, and not even just the products, but like the clinical applications for them, and kind of different scenarios or conditions for patients. So generalized topics, but then also product specific. And then you're in cases, so in the surgeries in the operating room, visually seeing what's going on and being able to be a kind of a advisor to the physician. And we also, I'm trying to think what else we do. We do lunches for our education a lot of the time. So we'll bring like breakfast, lunch, or like snacks during those presentations for them. And then thirdly, I will say it's a lot of traveling, which I love. But oftentimes I'll be in Minnesota, like at my company's headquarters for training or for seminars. So like I recently hosted some nurses and techs in Minnesota, and we kind of went over like a bunch of clinical stuff.
Okay.
Yeah.
So this is definitely one of those jobs like you have to be like well informed about what you're doing.
Yes.
You can get questions. You got to like, again, you're in the operating room, so it's like that's not somewhere you can not know.
Yeah.
Something.
Especially if it pertains to your company, which it's okay if you don't know the answer to something. But what I've learned is just to say, or like what people will definitely tell you in an interview, if you don't know the answer, just say you don't know the answer, but you'll get back to the person, because this is something that again could potentially positively or negatively impact the patient.
Okay.
So you don't want to tell the doctor, oh yeah, that's fine, and it's not fine.
Right.
or you see a nurse or a tech doing something incorrectly with the product.
Yeah.
And yeah, so
Okay. So I'm gonna need your so far. What's your favorite experience and what's your least favorite experience?
that's a good question, Josh. My favorite experience. Okay, I'll say this because it's been recent, and it's not just one particular like experience, or like situation, but I would say like the times where I'm like super nervous walking into a case,
Mm-hmm.
like by myself. Because so for my role, I have a territory manager that I'm under and
Mm-hmm.
working with. And a lot of times he's there,
Mm-hmm.
and so a lot of the questions will be
Yeah.
directed to him.
Okay.
But the times where I'm by myself and they're asking me something, and I know I'm gonna be like super nervous, but I end up telling them the right thing,
Mm-hmm.
and everything goes smoothly. And so I walk out the day, and I'm like, okay, it's sunny outside. I'm gonna
Yeah.
enjoy the rest of the day. So it's just the situations where like I walk in being nervous, thinking that I might mess up or make a mistake,
Right.
and it's the opposite.
Okay. What about your
The okay,
that
least
was
favorite.
that wasn't the least favorite?
No, that was the most favorite.
We can I need like
Specific.
yeah, like I wanna like visualize, not conceptualize.
I mean, okay, being more specific with that is like that seminar I just talked about,
Mm-hmm.
where I was hosting three other people
Mm-hmm.
in Minnesota, and they're like more tenured and experienced than I am. And I was just like super nervous hosting them because
Mm-hmm.
I'm like, they're going to ask me so many questions that I don't know the answer to.
Mm-hmm.
And I ended up actually educating them on stuff that they didn't even know
Yeah.
about. And they walked away with, having a
Yeah.
good time up there and learning a lot.
Yeah.
So
I know that was a good feeling.
it
Yeah.
was, yeah.
Okay.
So, least favorite experience.
Or like an experience that you was like,
Okay.
oh, I don't want to do this no more.
Yeah. So the training for my role was pretty intense.
Mm-hmm.
Like I said, I'm not a good test taker, and it was a lot of tests to take. So that was my least favorite. But at the same time, like they obviously had to like test us on stuff
Mm.
because the
Yeah.
but yeah, that would be my like, least
Okay.
favorite thing. It was
Okay.
just a very rigorous training program,
Mm-hmm.
which is a good thing,
Mm-hmm.
but
Okay.
PTSD.
Yeah. Yeah, tests. I'm glad. Like, even when people say like they miss college, like
I do miss college.
no,
I would do it all over.
no, I would not.
Oh,
I
you're
would
crazy.
not. I would not do it all over because again, like going to class and taking tests. Like for me,
It's worth it.
I was a good test taker, but I didn't study. So that was like I was able to like finesse tests and like I'm able to like what's the word? Dang. See, I haven't been taking tests for so long. I'll be forgetting some words and terms. What's the thing when it's like you can like eliminate options?
Process of elimination.
Process of elimination.
Okay.
I was very good at that. Like I'm like, yeah, that ain't it.
See,
That
I
ain't it.
wouldn't.
I was great at that, and then I should play the lottery and stuff because I'll just be like, yeah, yeah, boom, 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 boom. But like
Yeah.
again, like chemistry is like, no, you just gotta answer the question, no multiple choice, nothing like that. And just like,
Yeah.
see, I don't know this much because I didn't study.
Yeah.
But well, I didn't say it like that. Let me not say I didn't study because my mom be watching stuff like this. So I was definitely studying, but I wasn't studying as hard as I could have because I just wasn't interested in the subject. Just to be honest, like just knowing myself, knowing what I was interested in, knowing what I wanted to spend my time in. Definitely the social aspect and networking aspect of college, I loved so much.
Oh, we know.
But for me to like go back to like taking tests, I enjoyed it for what it was, and it's a memory in my mind. But I might go back to school, so who knows? Okay.
You say you're going back to school?
I might.
Okay.
I
For
might.
what?
I've been thinking of like what I'm actually good at, what I like. So like I do like leadership. I do like, informing people and educating. So it's like might be something like leadership, doctorates in leadership or doctorates like in some type of educational role or something. But when I think about school, I think about tests and it's like, I don't really want to do that. So
Yeah.
I might have to just wait and see. Yeah, I give myself like a few more years to like really decide if I will go back or not.
Plus, I mean, yeah, it's like better to know before you
Right.
start.
Yeah. And know what I can get out of it.
Because you're paying all that money to go back to school, and it might not even be something that you're
right. So I'm still wanting to live life more.
and we're
Work.
young too. I'm pushing 30, but you're young.
We're like the same age.
No.
We're the same age. We're the exact same age.
But I mean, I feel like you have time.
Yeah. Okay. Do you have any advice to like anybody viewing in anything? It can be in medical devices, it can be in life, it can be on school, it can be on anything.
It sounds very cliche to say, and it's been said so many times, but do not compare yourself to other people.
That's
And that was
one.
the biggest thing. Like after graduating, and I have friends moving out of state because they have job opportunities there, or they get like 6-figure jobs like right off the bat, and then it's just like, okay, and then it's like you're trying, and you feel like you're trying as hard as you can, but you're still not where they are, and then that can just add on extra pressure that you don't even need.
Yeah, I like that one. I like that one.
Yeah, so it's like, your time will come.
There's a phrase about comparing. Like I really can't remember no phrases, no terms.
Comparison is the thief of joy.
Yes,
yeah.
And that's true though.
It really is.
It's very true.
Yeah. But what advice would you give?
To who?
To your listeners.
I mean, to my listener,
who feel like they're stuck, or don't necessarily see any other opportunities out there.
I mean, honestly, I would say first, you're not the only one. Like I think throughout my process, and again, like transparency, like I'm still in the process.
Yeah.
I would think like I'm the only one going through this. Like I definitely thought that I was having it hard, but a lot of more people that you think are going through the same thing, if not worse, if not longer, if not with more limitations. Like again, people are going through what we could be going through, but with children, or they could be going through what we're going through, but in a whole different part of the U.S. I don't even want to say the world, but like a whole part of the U.S. where it's like they could be in a city that don't even have opportunities for you to like actually attain things. So they're forced to like move out.
Yeah, they can't stay with their parents. So
right.
Yeah.
So it's like even though like I would love to move out of Atlanta, it's like there's so many opportunities here for me to be like, all right, like I could literally live in a city where it's like there's no opportunities at all. And so that adds on an extra tax. So it's like just knowing that, it is definitely a tough process. I'm not undermining that at all, like regardless of who you are, but like I think it's kind of humbling to think that's like, okay, I'm not the only person going through this, but at the same time, accountability, like you have to put in the work. Like I'm like, well, I was about to say spiritual, but not spiritual like rocks and stuff. But like I'm definitely like I'm a Christian and stuff like that. So it's like praying and stuff.
The rocks into it, the crystals.
Because when you say spiritual nowadays, that means something else.
True, yeah.
But it's like people would like pray to God, be like, God, please bless me with this. But like you got to put in the work.
Yeah.
You got to put in like again, like you went through the whole interview process. Like you have to apply to these jobs. You have to touch up. You got to network. You got to do something. You literally have to, especially if you want something. Like you can just get the blessing, drop on your lap.
Yeah.
But like, are you gonna just wait, or like you got to put in the work? You literally have to, and that's something that was a big realization for me, especially when you do have like different accolades and qualifications and things like that. It's like, regardless of all that, like you got to put in the work continuously, because that time is going to come, and it's like you got to be prepared for it. You got to be prepared. Like you could get the job interview that you wanted, but it's like, oh wow, so I don't even know what to do at the interview. It's like, all right, so you just missed the opportunity. So I think those are like the main two things. I mean, just cliche stuff like keep pushing. Like all those are cliche, but I feel like the cliche things they're so cliche because it's easy to say, but it's not easy to do. Like people say be disciplined, but it's like discipline is one of the hardest things to be. It's like going against what you want to do.
Yeah.
Which no one wants to do voluntarily. cliche to say it, but it's like to do it is like a whole different thing.
I was gonna say or not funny enough, but I think that affirmations, unpopular opinion, affirmations can only take you so far.
Right.
And it was actually funny because I just moved, and as I was moving, I had like a paper that I found like one of my drawers, and it was an affirmation that I literally wrote like 100 times over and over every single day. And I was like, oh wow, like my affirmations, like that's where I'm at right now. But I mean, that consisted of me putting in a lot of hours, a lot of like humbling myself and like stepping out of my comfort zone, reaching out to people on LinkedIn. And another thing that's kind of crazy is you would say I'm naturally an introverted person, right?
No.
What? You don't think I'm a shy person? Like if you first meet me, obviously like not when we're friends. But have you seen me interact with other people?
I haven't seen you interact with other people, but
even if you didn't agree, you should have just said yes, Josh, for an interview.
Anyway. No, but how I've viewed that, it's like
you wouldn't call me an extrovert though.
I wouldn't call you an extrovert. I wouldn't call you an extrovert, but I would just say like you're genuinely like nice person, and I don't really. But it's like you're not. I wouldn't say you're shy though.
But okay, I wouldn't say like I get social anxiety like walking in places. Okay, and I can
see that. I can see that.
Like if it's a stranger, I'm not. If it's like, let's say you're having a party and I only know you, I'm only going to be next to you.
Yeah.
I'm not the type of person to like reach out to people or not reach out to people, but like walk up to somebody.
No, okay. Yeah. You're right.
With my job, I have to like, I can't be that way. So I kind of have to like flip that switch and be extroverted.
Yeah.
So I think it's helped me like step out of my comfort zone. But yeah, stepping out of my comfort zone to DM people on LinkedIn, which is not like my character, I feel like, even though you say otherwise, whatever. And then just like reading, I did a lot of reading of like books, and listening to podcasts just to kind of build up, you know, my confidence when it came to me interviewing or like me saying the right things. And then when I got the job, actually like putting in the effort to, you know, be successful in it. But I'm still new, so fingers crossed. But like also being humble enough to know that like I need to be on top of my things because everything could easily go away.
I think that's a big thing right there. Like even I'm not going to say scrap everything that I just said, but like being humble regardless of whatever, like that's the important thing. Because right now I'm not too big to do anything. Like I think that's like that's another aspect. Like especially those who like, you know, say you get this degree, you get this degree, you get this, you get that, and you just think like you're above a certain thing. Nah, like you actually got to humble yourself to the point. It's like right now, and I think it's definitely for like your journey and just for your testimony unto others. But it's like, don't think you're too big to do something. You don't think you're too big to talk to this person. Don't think you're too big to reach out to this person. Don't think you're too big to respond to this person, to respect this person, to anything. Like, because you're not. Just keep it a bug. Like, keep it a bug. However big you are, however big you think you are, you're not.
You're
just
not.
simple as that. Like, you got the money, you got the looks, you got the degrees. However you view yourself to other people,
take it down about
to other people, like it don't matter. It does not matter at all. Because again, there's jobs that I've been denied from. It's like this, like very basic. Like, yeah, no, that's literally how it is. Like y'all deny me. Like I've done this job before. Like I succeeded in this job before. You be like, they'll be like deny, and you thinking that they're missing out, but for them it's like you wanted somebody else, and it's like you still looking for a job though,
and they also hire people for different reasons. Like it might not even have anything to do with like how you are as a candidate. It could be because this person lives closer to us. But they got it. So and you just gonna have to take that L.
Okay.
But I also feel like I'm on the opposite end of it too, a little bit, like a little bit on the other side of the spectrum, because I do have imposter syndrome a lot of the times. So that's something I'm working on.
Okay. So humble yourself, but also
be confident enough in your talents and your knowledge.
Okay. I'm gonna clip that one. That's a good clip right there.
Do you think so?
That's a good clip. Yeah. Okay. Do you have any advice for me as far as like with paid passion or just anything overall?
Yeah, well, I think what you're doing is great. Exposing people to what's out there.
Mm-hmm.
I've seen like Jeff's interview, him being a lawyer, but then like also like Cheyenne with like her business, and you just have different people
Mm-hmm.
on there like in different avenues. We keep
Mm-hmm.
saying that needs to be the title of this episode as avenues.
Wait.
Avenues, because we've been saying avenues so many times.
Yeah.
Yeah, it's been at least 10 times.
I'm gonna have to rewatch.
But anywho, like you're just showcasing the possibilities and opportunities out there, and I think that's a great thing. So I say, just keep doing what you're doing, and like find people in different, avenues, and I think that'll like give people on the other side of it, hope.
Okay.
And they're not just stuck to this one little bitty bubble, and then they get super stressed because their friends are getting like high-paying, successful jobs, and they're not there. But they also feel like, oh my gosh, what am I gonna do?
Yeah.
Feel like there are other opportunities out there.
Okay. And then, so my last question for you is, what is orange but sounds like a parrot?
Orange but sounds like a parrot. Is this a trick question?
It could be. It depends how you answer it.
Orange but sounds like a parrot?
Orange but sounds like a parrot.
I'm not good with riddles.
It's really simple.
Okay, Mr. Simple, you want to give me a hint?
Okay.
Sounds like a parrot.
Yeah, I'm about to give you the hint. It's orange and it sounds like a parrot.
But technically parrots, they can repeat anything. So
what's orange though?
Donald Trump? Because parrots can repeat anything, so they could sound like humans, and Donald Trump is orange. So I don't know. What's okay? Give me another hint.
Another hint. It sounds like a parrot and it's orange.
Oh wow, that really changed it up.
Yeah, because before I said that it's orange and it sounds like a parrot.
Yeah.
But now I said it sounds like a parrot and it's orange. So that's like that's honestly a very good hint right there. Like, really if I got that hint, I would have said the right answer right now.
Yeah. Yeah, Josh. Unfortunately, I don't know it.
A carrot.
But how could it sound like a parrot though?
No, because carrot sounds like parrot.
Rhymes with parrot.
Rhyming deals with sounds.
Okay.
Right?
Whatever.
Alrighty. Thank you for tuning in to another episode of Paid and Passion. Let your passion work for you. Peace.